Namaste, good afternoon. I have here a very distinguished guest. She is Professor Dr. Meenu Singh. She's the CEO and Executive Director of All India Institute of Medical Science, AIIMS, Rishikesh, India. She has a very busy schedule, but we are so grateful to have here with us at Plants to Patient Series 3. Good morning, Professors. Meenu. Thank you so much for coming here. We are so happy to have you here with us. So how do you find the conference so far?
I think it's wonderful. You have so many young people who are participating, and you have all the professors who are mentoring them and teaching them about the new ways in which diseases can be treated. Although traditional medicine is old, but actually it is now being used in a very modern way. And as it's being combined with the modern system of medicine, which we now call as integrative medicine, it is something which is proving as a boon to the populations because they are able to handle their illness in a much better way.
Very, very good advice. So what Patanjali Research Institute has been doing or is doing is to promote, like what you say, the traditional old medicine and then supporting it with modern science together and bring it to the forefront. So what is your vision or what would you advise our scientists as we move forward to this journey?
I think I have been associated with Patanjali for a very long time. Although I came to Rishikesh only 6 months ago, and then I started visiting this place. But otherwise, because of Pujneer Swamiji, because he has been a proponent of yoga, and he's actually made yoga a household word all over the world actually. And so I had been a practitioner of yoga, the way he was teaching for almost last 20 years. And what I realize is that this certainly gives you a very positive approach towards life. So as far as my future vision is concerned, I think we still continue to make yoga the best way of life. And we should try to teach our children right from the beginning the value of yoga and they getting into the practice of yoga rather than just being taught theoretically or just being given some demonstration. It is something which should become a part of their lives. So I think we have to continue to work in that direction because new children are getting added, every second. So all of them would need to be trained and treated. And other thing is that we have this wealth of information which is lying in our own scriptures and our Ayurvedic textbooks, where we have plants which are, we know that you have created a very big encyclopedia, Patanjali has created a very big encyclopedia of medicinal plants. And I think with so much work done, it's time to use all that information which is available in clinical practice. And for use in clinical practice, it becomes very important that you prove, what you're saying. Although a lot of things are well established, everybody knows that turmeric helps in so many things and it has to be used. And they didn't even grant a patent for this because it was something which was internationally acceptable. But there would be certain medications which are used for different diseases. They may require careful evaluation. For example, there might be some herbs or plants or metals which may damage some of our organs, and hence the formulation needs to be very accurate. It needs to be very transparent and explicit, and then we should try to scientifically test it in the form of what we call as these human experiments, which are randomized controlled trials, and from those we find the outcomes, and then we generalize it. Then we can even do some reviews or systematic reviews by combining the effects of these trials which have been done, and then these come into the guidelines. And there should now be guidelines about using traditional products for treating diseases. I think we have reached that stage. That is what should be there for the future.
Very, very good advice. Such good advice and words of encouragement from Professor Meenu Singh. We certainly will take that. Will listen to you as we continue our journey in bridging together traditional medicines and science. So, just in one line, describe Patanjali Research Institute.
The best institute of Ayurveda in the country.
We are so grateful for that. Thank you, Professor. Thank you so much for coming despite your busy schedule. But we hope to see you again in the near future.
Thank you so much. Thank you.